Hi, I'm Ian Weber. I am an orthopedic surgeon specializing in hip and knee replacements as well as trauma, and I practice here at CommonSpirit St. Anthony's North Hospital. Yeah, I think choosing specialties, I think I chose orthopedics, and then within orthopedics, it was a matter of what I really liked, and I really was pulled between trauma and joint replacement, so I ended up doing a fellowship in both. And what I really liked was in trauma, taking a significant injury and putting someone almost, you could say, back together again and getting them up walking. It's always fun to do that, but also watching the rehab and getting people back after something such tragic as a trauma event. And on the joint replacement side, it was, taking people who had mobility at some point in their life, and it's just slowly getting less and less, and then we're able to restore that and seeing people go out and do things again, go to their daughter's wedding, being able to walk them down the aisle, being able to take a vacation again. It's really fulfilling. Yeah, I've been at a lot of hospitals over my career, and St. Anthony's North has been the best. And I don't know how to describe it in a few words, but it's a collaboration I have with the other specialists. It's the amount of help one another we give each other. We call each other all the time. The collaboration is amazing. The administration is great. Operating rooms are the best I've ever seen. It's the dedication to safety, to patient, to results, outcomes. And it's the nurses, it's my scrub techs, it's my anesthesia colleagues. It's such a great environment. When you come to work and you're happy every time, you know you're at a good place. Yeah, approach to patient care is access. Either if it's a concern of a phone call, we answer it immediately. We don't really necessarily park the call. We don't have a message that says we'll call you back in 48 to 72 hours. We get back to you almost immediately. The other option also is coming in. We always have space. We can always squeeze somebody in, so if there's an urgency or emergency. So for me, patient care is about access. It's about answering questions. It's about removing the anxiety that occurs with before or after surgery. Yeah, so a new patient will always see me first, and I really do believe that. That we don't necessarily have new patients see some of my mid-levels, though my mid-levels are unbelievable and excellent. We just believe that first interaction should be with the physician. So when you come to visit me at the office, you're going to see me first. We're going to go through the discussion. We're going to go through a treatment plan. We're going to go over everything. We're going to make sure we get a diagnosis, or if we need further imaging studies to find that diagnosis, we'll get it done. And when you do become a patient in our clinic, it's the access. You will always have access to us and my PAs, my staff. You will see a really incredible clinic service that really caters to patient expectations. It's also why we won in my clinic, the #1 clinic in the mountain region. Outside of work, I love to get outside. I mean, this is why we love Colorado. This is why we love the mountains. And the activities I really like is hiking. I love road biking. I love getting to the mountains in the winter, really embracing the winter activities. Definitely try to stay active, try to stay both from a physical and mental health. Just getting outside, I think, really does help. And I think that's why in Colorado we have such a strong community, as we do have these outdoor activities.